Hello everyone, I am Dr. Priya. I started working as a general practitioner at a small clinic after my NEET PG exam. At this point of time, I already had enough experience of working at various private hospitals, so I was able to identify emergency cases and the cases which can be managed at a clinic. I worked in various departments: neurology, urology, cardiology, surgical, OPG departments. I wanted to apply the knowledge which I built up in these years. So we found a clinic which needed a female doctor. The people who come to this clinic are low income people who can't afford treatment at private hospitals. We usually take up cases which are minor and can be handled at clinic. This clinic had two beds, a table, and a chair. Devices like IR thermometer, a stethoscope, digital BP machine, my stamp, pulse oximeter, ampule breaker, a manual sphygmomanometer, and a weight machine. Once the flow of patients increased, I had a wide range of cases, starting with otitis externa, viral conjunctivitis, allergic rhinitis, pharyngitis, acute exacerbation of asthma. There was a heart failure case. There were a lot of cases with cervical pain, lumbar pain, and abdominal pain. There were cases with hypotension, hypertension, diabetes mellitus, and hypothyroidism. There were minor RTA cases with abrasions. There were scalp lacerations which needed suturing, distal phalanx injury in a mixer. There was glass piece dislodged into tip of finger, multiple burn injuries, nail avulsion injuries. There were hematoma cases. There was an extreme need to update myself and then refer a lot of textbooks. I had to talk to various consultants. Luckily, I knew a lot of consultants in that area because I was working in the same area at various private hospitals. As a general practitioner, we should be able to insert IV cannula by ourselves, give IM medications, give local anesthesia, do suturing by ourselves. There would be a lot of cellulitis and abscess cases which will need dressing. Along with that, we have to take a good history, do a good physical examination, counsel the patient regarding the disease progression, what might be the red flags in each case, and when they have to go to an ER or come back to clinic. The most important thing for a general practitioner is to identify the most critical cases which might need immediate referral to a higher center or an emergency. Working as a general practitioner definitely gives exposure to a wide range of cases. You will get most critical cases to a clinic because the patient themselves won't realize that it's something critical and they have to be admitted into hospitals, and you are the first person who is going to meet that patient. There will be a lot of marketing people meeting you every single day, or maybe at the end of every month or beginning of every month, from various hospitals nearby, the private ones, or there might be these pharmaceutical companies visiting you every now and then. Thank you so much for watching. That's it for today, and it's Priya signing off.